Hi, welcome. I'm Nira Berry, the happiness coach, and I'm your host of Happy and Healthy, where we explore all the many ways of keeping you feeling happy and healthy. And today we're going to explore ways of keeping your kids feeling happy and healthy. So please welcome my guest today, Dr. Giorgio Kulp. He's a pediatrician, and he has a lot of good information about kids and how to keep them, happy, healthy, and leading fulfilled lives. So tell me, I know you've been a doctor for over 20 years, right?
Yes,
Yeah.
and thank you, Nira, for having me on the show.
Sure, my pleasure. So being a doctor for so many years, what's the number one thing that you've encountered that most parents bring their kids in for?
Well, most parents are concerned about their child's growth, their child's eating, their development, and we often cover a lot of those issues in our office. There's some funny, other topics that we cover, like how much sand is too much sand to eat.
Oh, really?
Or like my child ate a light bulb.
Oh, wow.
What do we do about that? So I've been thinking
Wow.
about writing a book on those topics. Funny anecdotes that we experience in pediatrics, but nonetheless, the main things are, is my child okay? Is my child, gonna be growing okay? A lot of concerns about eating and about size and shape, and so.
Yeah, and I imagine that colds are probably a big aspect of people bringing their kids in, right?
Yeah, I mean, certainly, parents are concerned about their children with respect to respiratory issues or whether they happen to have fevers that might be bothering them. Something that parents are often concerned about is how high the fever is, and typically we don't consider a fever to be anything, under 100.5, but you can get some really concerned parents around temperatures that are, 99. Really what matters most is the way the child looks, more so than the child's, temperature. Yeah. And, I think that you also have to let the immune system to some degree actually do what it's supposed to do. And in this sort of world of quick fix kind of attitudes, we're sort of trying our best to sort of let parents know that it's okay to let the immune system work and not necessarily expect that there's a quick fix like an antibiotic for colds or or whatnot. So our goal is to try to empower parents and make them feel confident about the situation as it is. And so oftentimes it's really just giving a parent some peace of mind when they bring their children in.
Yeah, so I was just going to ask you, are there any quick fixes, for colds or anything that parents can do that'll, maybe help prevent it, or any thoughts on that?
Certainly the best things to do are just good hand washing and trying to make sure that kids are, mindful about how they cough, how they sneeze, using your sort of elbow to sort of cover your mouth. Yeah, I think that hand washing is key. I think also just doing some simple symptomatic sort of care procedures at home, like nasal saline and steam treatments in the bathroom and head of the bed up so that they can sleep more comfortably rather than languish in their mucus. But nonetheless, I think that you just have to give the parents some peace of mind that their child is going to get through it. It might take 10 days for most colds, but nonetheless, they'll get through it.
So, what I'm getting from what you're saying is that being a pediatrician is not just taking care of the children, but also the parents.
It is all about taking care of the parents. And I think that, in reality, what we do as pediatricians in reality is taking care of the parents through education and also educating the kids. So on the one hand, we're trying to heal the child from an ear infection, from strep throat, et cetera. But really what we're doing is educating the child and educating the parents so that the parents feel empowered. The next time the same thing happens, they know how to handle it the next time.
Yeah, so...
And the late night calls don't come in, at 3 in the morning about something that the parent has experienced 3 times before. They know sort of how to handle that.
Yeah.
But prevention is key, and I think immunizations are really important. I think that, in this day and age, we're really trying desperately to sort of make sure that parents are aware of the benefit and the impact of immunizations. we really consider immunizations one of the greatest inventions of mankind in many respects.
Yeah, and it's been such a controversial topic. I hear about so many parents that, I mean, they have blogs about it. I mean, it's really like a very big topic that, you know, to not vaccinate the children because they're afraid of autism, they're afraid of so many different rumors out there that
Right.
it's hard to identify what's really accurate.
Yeah, I mean, a lot of these things have been debunked, quite frankly. They've all been debunked. Certainly, you know, autism is scary because it still isn't clear what, you know, its etiology is, what its cause is. So we're still, you know, we're still looking at multifactorial issues that play a role. But the reality is that when it comes to immunizations, clearly no evidence of that. And I think that we're just trying to work with parents to understand that, make sure that they don't feel conflicted about it, but at the same time trying to preserve the public health and making sure that the kids in the waiting room or the kids in school or the kids at camp aren't you know, affected by an unimmunized child. So we're doing our best. There are practices in the country that will you know, say our way or the highway, and so they adopt a very cut and dry approach to immunization. Our practice, though we're very, you know, very committed to immunization, we're willing to sort of give parents a little bit of leeway, very little leeway, in terms of, you know, giving them a sense of empowerment to make choices as to when they might immunize. But ultimately, we want them to immunize in a very timely fashion.
Yeah, because like you said, it impacts not only the child, but also people, the community at large.
Yeah.
Because if the child is sick, it could they could impact maybe an older person that they may encounter even at the grocery store. Who knows? You know.
Absolutely, and
not
you know,
just their family.
the
also.
immunocompromised people, you know, the people with cancer, et cetera.
Right.
So yeah, it's a pretty profound issue, and I think that hopefully with a lot more information out there, there'll be a lot more, you know, sort of uptake on that.
And you said that all these things that people worry about, they've all been debunked.
Yeah, absolutely. I mean, the scientist in England who really created the trouble Wakefield was, I think, might have even been, you know, imprisoned or certainly fined for his impact on this.
Yeah,
So,
rightfully so, it seems.
absolutely.
Wow.
Absolutely.
So that's something that you have to navigate through, you know, being a pediatrician as well.
I mean, again, you're trying to tread lightly with parents who are obviously concerned about, you know, their child's well-being, and yet you want to make sure that you're sort of thinking about the public health.
Yeah.
And so we live by scientific code. You know, we live by this you know, this Hippocratic oath not to do any harm, but at the same time also to make sure that we're going ahead and giving the child the best bet for a healthy, you know, future life.
Yeah, absolutely.
Yeah.
So what could, since you do work with parents, and what maybe you can alleviate some of their concerns, and maybe, you know, if you can give some tips that might help them, or advice on the different stages of their children, maybe starting from, you know, newborns, toddlers, you know, maybe you can, you know, walk us through that.
So I think the biggest, I think that one of the most critical and difficult things for a parent to get through is the impact of uncertainty and the impact of sort of feeling how do you say, just sort of incapable of control. You know, they're out of control. Children, you know, the act of being a parent is one of relinquishing control to this other little person.
As a human being.
Oh my gosh, and the sleeplessness, you know, can really create havoc for, you know, a parent, for the couple. Certainly you worry about marital discord. You worry about, you know, a single mother's capacity to maintain, you know, a normal life after birth. There's so many, some of the worst arguments I've ever had with my wife were soon after, you know, the baby was born in the middle of the night, 3 o'clock in the morning, and you're dealing with
I want to do it
feeding.
this way, I want it that way.
Well, you're just sleepless, and you know, it's just not easy to be sleepless, and there's also the potential for, you know, postpartum depression and a lot of mental health issues that come into play when the child's, just born and parents are sort of getting accustomed to managing that routine.
So they have this other human to care for, and
there's no guide.
Needs.
There's no guide. There's no manual. So we do the best we can to educate them about that. But basically the first couple months, it's really about bonding, and it's really about sort of getting accustomed to a routine and sort of developing this little person into someone who's a little bit more responsive. When they start to reciprocally smile at 2 months of age, and they're sort of like giving you some feedback that gives you that sort of sense, I'm doing this for a reason, and I've been keeping you alive for a while so that I can make this, so I can get some gratification out of it. No, I mean it's hard, but the bottom line is the kids seem to be doing well in most cases, and most parents are happy with the outcomes. And then there's solid foods, and and the whole aspect of trying to get the child to sleep.
And I know that there's different theories, and people swear by different ways, is whether or not they should really have like a strict routine, or they should just let the baby determine what it wants when it wants.
Right. I think that, again, in a place like Washington, D.C., where you've got a lot of highly educated parents who have come from backgrounds where they control a lot of their lives and in their professional work, they come to this situation and they feel, my gosh, I am totally out of control, and I don't have any capacity to maintain some semblance of control. So what they end up doing is they expect routines. They expect these kinds of schedules.
And is that good for the baby?
It's not necessarily good or bad. I think it helps the parent maintain that comfort in their own way. But I think that ultimately the baby has control, and the schedules don't necessarily make much of a difference.
Well, that's good to know. So let's continue talking about that. We're going to just take a short break. And I'm Nira Berry, your host of Happy and Healthy, and we'll be right back. Stay tuned.
We just finished dinner, and it was time for homework. He hates homework. I know he's bright.
Why is it so hard for me?
He's just
trying
gotta
as
try a
hard
little
as
harder.
I can.
1 in 5 children struggle with learning and attention issues. Go from misunderstanding to understood.org.
The odds of this boy achieving his dream in fashion? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 68. I am Tommy Hilfiger. Learn more at autismspeaks.org/signs.
Hi, welcome back. I'm Nira Berry, happiness coach and your host of Happy and Healthy. And we're going to continue speaking with Dr. Giorgio Kulp. He's a pediatrician, and I think really like the go-to person for anyone who is a parent.
Sort of a life coach for parents.
Right,
in some
right.
respects.
You're like the point person, for every aspect of the kids' lives, and for the parents and managing it and everything. And so let's go on and we spoke about babies, newborns, and what other stages are important things for people to know about?
So I mean, as the children get a little older in age, they start to eat solid foods. They start to become toddlers. They're talking, they're running, they're jumping, and all the while, parents are always checking those growth charts, always saying, is he growing? Is she in the 90th percentile, or is she in the 25th percentile? And I think the important thing when I talk to parents is making sure that they understand it's not about where your child lies in relation to other children. It's about where they lie in relation to themselves. We're looking at genetics, and we're looking at parents who might be 5'6" and 5'7", and they're not going to have that 6-foot child,
or they might.
Or they might. Exactly. It could go either way.
Yeah, because I'm relatively on the shorter side, and my son is 6'4", and I don't know where that came from. You just never know.
Skipped a generation or something. Who knows where it came from?
You just never know.
But I think
so. A lot of it, I guess, is managing expectations.
Right. It's about giving parents that sense of confidence that their child is going to really achieve what they're supposed to achieve in their own way, and not to put too much pressure on the kids, because as they get a little older, it really does become a hardship for the children to sort of like be under that constant scrutiny, which ultimately is one of the reasons why kids like myself, when they go to college, they sort of fly the coop and they say, hey, I want to go as far away from home as I can. And then they end up, becoming, liberated from under that helicopter parent. this is a hard transition to make, and you've got that sort of separation, which becomes hard, especially in the teen years when kids are starting to drive and they're starting to sort of be seen at the doctors by themselves. The parents want to know what's going on with the child, and we've expressly told them that we want to go ahead and try to develop a relationship with them ourselves so that they have another advocate. So
they can speak freely to you.
Absolutely.
And, yeah.
Absolutely.
That's got to be very tough. I know I've experienced that, so I know it's very, very tough.
Yeah.
And so, do you, when the kids do come in, do they share a lot with you?
They do. Yeah. They share quite a bit. Once I had a child talk to me about his substance use, and was telling me that he was using the substance quite a bit. And I asked him, so where do you get the substances from? And he said, I get them from my uncle. And I went and talked to the mother, and the mother said to me, so I hope he's not doing, did he tell you about the drugs he's doing? And I said, yeah. And so she knew all about it. And she said, I just hope he doesn't turn into my brother. So little did she know that that her brother was supplying the substances to him. Nonetheless, the fact is that there's a lot of concern with respect to substance abuse, mental health in the teenagers, and I think that there's a lot of pressure on the kids, especially in the Washington D.C. area. There are a lot of expectations. I've come around from asking how you're doing in school to do you enjoy school? What about school do you enjoy? What are your favorite subjects? Because I think that a lot of these kids have difficulty motivating when they're under so much pressure. They also find alternative ways of self-medicating, to sort of dull the anxiety they feel, and so it's hard.
Yeah, and so what advice could you give the parents to maybe not help their kids be so stressed, to prevent their kids from being so stressed out and feeling under pressure, right, to succeed in school and maybe even to succeed in sports? Sometimes they have the kids signed up in 3 different types of sports and after-school activities.
Yeah. I think that in a perfect world you'd have more downtime. Back in our day and age, we didn't have all these activities necessarily lined up one after another. We were able to be kids more often and play outside on the street and not have all the video games to sort of draw our attention to, which, by the way, happens daily with the 1-year-olds and the 2-year-olds who are crying incessantly, and the parent gives them the iPhone, and the child is looking at the iPhone, and suddenly they are just drugged. They're just like, ooh, this is very enticing. And so we're trying our best to sort of, tell parents, try to avoid these kinds of stimulants. I mean, it's a stimulant.
Yeah, and it's they use it like as a babysitter. I've seen that
Absolutely.
happen even in the grocery store,
Yep.
and I've seen the baby sitting in a cart just holding on to device and not even experiencing what's around him, like not
Absolutely.
looking at people, seeing interactions, not looking at the different color fruits or vegetables.
Absolutely.
They're just like totally engrossed in this device that's just a few inches from their eyes.
Right.
And that's
And
another thing might not be good for.
I mean, they're letting life pass them by. I mean, in terms of mindfulness coaching and in terms of meditation, the whole idea behind that kind of experience is to sort of keep your mind in the present. And I think that oftentimes, parents are sort of not aware that they could actually do their children some good and themselves some good by maybe taking on some of those, practices.
And just really being in the present to really just enjoy their kids for whoever they are, whatever their interests are.
Absolutely, and not try to mold them into something otherwise. I think that there's really a lot of...
I bet you see that a lot.
Yeah, and I mean, it's great to cultivate something that the child is strong in. There's also, something great to, sort of try to help the child improve in. So, for instance, when parents ask me, what should I get them into? I often say, if the child isn't particularly strong, maybe you get them into some gymnastics so that they develop some strength, or if they're not terribly balanced, same thing. And the same thing would hold true if they have a really great strength. If if they're really coordinated, maybe you want to cultivate that. Maybe you want to see how far they can get. But again, let the child make that choice.
Yeah, that's true. I know some people that really push their kids in gymnastics, and they had to, I think, work out like several hours a day, 5 days a week. And at some point, I think their pediatrician had said to them, like, if you do the same exercise every single day for I don't know how many hours a week, that it almost becomes like child abuse.
Absolutely.
Because it's too much for a growing child.
And you can also get these repetitive injuries, repetitive use injuries from doing the same thing with so much routine and so much repetition. And not only that, but at some point in time, sleep is going to suffer, because as they get older, the demands in school increase, and the after-school activities increase in number, or they increase in intensity, so they're longer hours. And what happens is some of these teenagers are going to bed at 1 or 2, waking up at 6:30, and they're getting 4 hours of sleep.
And is there something to that I know that they've raised the starting time of high school? That used to be earlier, and they've raised it. Is there really something to that?
That is something that pediatricians have been dying to sort of change for a long time.
Yeah.
I think the busing system has something to do with that, because typically they only have school buses for so many kids, so they use them for the high schools as well as for the same buses for the middle schools and elementary schools. So they have to stagger them, or they have to do them in some kind of an order.
Right.
So, these teenagers really have a totally different sleep sort of pattern, and we've got to go ahead and make sure that we're not getting them up too early. Let them sleep in a little bit. I think that there's no question that their brains are going to function far better if they're given enough time to sleep.
Wow. So there really is something to all that.
Yeah, and then it impacts their mental health, and and we want to make sure that they're happy as teenagers.
Yeah. And as far as like the internet, like that's something that has had an impact?
I mean, certainly it has a tremendous impact. They spend a fair amount of time on the internet, not just on video games, but also on other media. And there's no filter on that media. And you want to give the child some sense of adulthood, right? But you also are worried about the kinds of things they're being exposed to with respect to the internet safety kinds of issues, namely, inappropriate content.
There's a lot of peer pressure,
right,
imagine, trying to live up to what the images they see.
Absolutely, and they're comparing
the lifestyle.
They're comparing themselves all the time. This person went on that vacation, or this person, is wearing those kinds of clothes. And I think that can be pretty damning when it comes to trying to, convince yourself, hey, you know what, I'm okay the way I am.
Yeah.
So,
thank you so much for all this wonderful information. And I know that there's so much more that people might have questions about. So if somebody wanted to reach you, how could they do that? Do you want to give your website information?
So our website is www.metropolitanpediatrics.com, and we're located in North Bethesda.
Oh, great. And if there was, one or two pearls of wisdom that you could give the parents or the kids, what would that be?
I think the most important thing we've touched on is sort of like give your child a little bit of control. Make sure that you're sort of giving them a sense of competence in their own fields. And lastly, I think it's just enjoy the experience of parenting. There's something to be said about watching your child develop in a normal way and allowing life to take its shape.
Yeah, so basically just relax and let it happen, because everything will turn out okay.
Take a breather.
Take a breather and just
laugh
really,
a little bit.
Yeah, laugh a lot. Laugh a lot.
Laugh a lot.
Laugh every day.
Humor goes a long way.
Yeah. So I thank you so much, Dr. Giorgio Kulp. I really appreciate you coming in and giving us these wonderful words of wisdom that you've shared with us today. Thank you very much.
Thanks.
So I thank you so much for watching. We're going to continue with our Good to Know segment. I'm Nira Berry, your host of Happy and Healthy, so stay tuned. We'll be right back.
You It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But I get it, you're busy, and busy people can't have prediabetes. I read that wrong. They can, okay? Just go to the site.
Hi, welcome. I'm Nira Berry, happiness coach and host of Happy and Healthy. And now it's time for What's Good to Know. And as part of my series of success at life and at work, I want to speak to you about color and how it can really impact you and affect how you work in the world and how you go through life in general. And many of you may not even think about color in your everyday life. But really, when you think about it, when you're in a room in a certain color, if you really think about it, it may really affect how you feel and your senses, and whether or not you feel excited or whether or not you feel calm. And there's been a lot of studies about that it can really change how you feel. And even a very slight variation in color, such as lemon yellow to sea green, those different colors can affect your emotions and your senses in a different way and how you react to the world. And this is really something that a lot of people are not aware of, but there's certain colors that can affect you in different ways. For instance, dark blue is associated with night, so it indicates passivity. And blue-green and light blues, they're associated with calm. And that kind of calmness is really all through many different cultures, as well as red and orange. That color is very stimulating, and it's really a color that really promotes excitement. Like you might see that in casinos. And red can be very warm, but also arousing and exciting as well. And pink is also well known for calming, and this is really something that we can think about when we're in different environments in our home and at work, as well as in our own personal life. Very often I tell my clients that when they go for an interview or if they want to go through different things in their life, to really dress for success, because success sometimes comes in first impressions, right? And whether or not you're dressed in a suit for work, or whether or not it's appropriate for you to wear something else if you're a preschool teacher, that's all very important. But also what's important is for you to feel comfortable in your own skin and how you feel wearing the clothes or what you surround yourself in. And colors can make an impact in that. Very often, if you pay attention, like think about what colors you reach for in your closet when you're doing certain activities. Maybe you're going for a job interview and you want to feel more powerful. You might want to wear something red. Or maybe you just want to feel more light and happy. Maybe you want to wear something yellow. But I wouldn't suggest dressing like a yellow banana, but you can wear a suit and maybe wear a yellow tie, or maybe wear a dress with a yellow blouse underneath. All those can really work. And so think about next time when you dress, what colors you reach for, what you enjoy wearing, what you feel calm in, what relaxes you, or maybe what gives you more power and strength overall. So let me know what you think about this. You can always reach me. I'm the Happiness Coach at Happy and Healthy TV at mmctv.org. I'm Nira Berry, your host of Happy and Healthy, and I hope you have a great day.